You know when you're ready, Patrick. Okay. All right, so thanks everyone for coming. I really appreciate you spending your Friday night here, because I know a lot of us probably could have found different things to do with our Friday nights. I won't say more interesting, because I hope to be interesting. But I think if I weren't here, I'd be putting my feet up and playing computer games. So I'm very grateful that you all came to spend your time with us. Let's see, Patrick already asked you to turn off your phones. A little background about myself. My name is Merriam. I'm a student here at the Adler Graduate School. I'm earning my master's degree in counseling and psychotherapy. And this project is part of my graduation requirements. So I finished all my coursework. I've got one more paper to write, and then we're done. So you guys being here is a part of helping me graduate. So I'm pretty excited about that. So I really appreciate you guys coming for this. Let's see, what else? In the meantime, I've been working as a therapist in private practice for the last 3.5 years. I work in a group private practice. I'm under supervision. I have a licensed supervisor who looks out for me, and some of my colleagues are here today, which I really appreciate. And then after that, I'll be pursuing licensure as an LPC, licensed professional counselor, and then LPCC, licensed professional clinical counselor. Those letters might mean something to some of you. So those are my goals in the next couple of years. I also practice and teach Tai Chi, and I'm certified to teach by the Arthritis Foundation, to teach Tai Chi to people with arthritis and other health issues, and so that's part of my background that I bring to this. Tai Chi has been a fun addition to my life the last couple of years, and one of my Tai Chi pals is here too. Let's see. And then on a personal note, I have several kinds of pain and chronic illness. It's kind of a stupid laundry list. So that's what got me interested in working in this area, and I also work with a lot of people who have chronic pain, and it's tough work. And one of the things that I like to wrestle with is the language. You know, you can say I suffer from pain, I contend with pain, I wrestle with pain, I master pain, and sometimes I achieve that. Sometimes I manage pain, sometimes pain manages me. Sometimes I'm doing just fine, and sometimes I weep. But one thing that I don't do anymore is I don't feel helpless, because I've had periods in my life where I felt really helpless, and I'm very proud to say that I don't have that anymore. And part of the process that I went through to get past that point is a big part of what brings us here and what I want to share with you guys, because I don't want you or your patients or your loved ones to feel helpless, and so that's part of what I want to teach tonight, and what I want us to share with each other. So that's going to be part of our goal tonight, is sort of overcoming that feeling of helplessness that comes with some of this stuff. Because we all have our strong days and our weak days, and so there's going to be some ideas for what you can do on your not so strong days. Let's see. Also, an important tip about my background that might be helpful, as far as chronic health, disabilities, those kind of issues. My husband Michael, of 16 years, has a degenerative eye disease, which has made him legally blind. And so him going blind was a process that we went through together. And so I'm also a caregiver in that respect. He doesn't require a lot of care from me. He's pretty independent. But there are some times where we take turns helping each other. So I play all three roles. I'm a healthcare provider, I'm a caregiver, and I'm a person with illness. And that's why I wanted to invite all three of those types of people here tonight. And so there's going to be times where I'm speaking to the people with illness, or times where I'm going to be speaking to the providers. But I don't want you to turn off your hearing then, because there's still something for you to listen to. Because you may be the one teaching your doctor the concepts that I'm teaching you. You may be the one teaching your caregiver the concepts I'm teaching you. And so I still want you to hear those, because they might come in handy, because you might be the one setting those expectations for the future. So that's part of what we'll be doing tonight. Now I get to remember to do these kinds of things. So we're going to talk about what is chronic disease, kind of a why are we here kind of a thing. And basically, the National Center for Chronic Disease Prevention and Health Promotion gave us this handy diagnosis. Chronic disease are illnesses that are prolonged, that do not resolve spontaneously, cannot be cured completely, and or rarely are, and may involve some type of long-term disability that is irreversible. So that's what we consider a chronic disease. A lot of people relate to that. And then the health problem can be stabilized and controlled, but the affected individual cannot expect to return to the level that they were at before. All right. The most common chronic diseases in the U.S. are arthritis, cardiovascular disease, cancer, lung disease, and diabetes. But that's certainly not an exhaustive list. I know that doesn't cover all nine. So tonight we're going to be taking a holistic perspective. Holism is the belief that all aspects of life are interrelated, right? My mind is connected to my body. Myself is connected to yourself. Every self here is connected to all the other selves. We are all connected to you. We are the world, right? So we are all connected to everybody out there, okay? And being part of that cultural context and that community is a big part of what affects how successful we are at overcoming these diseases. All right. Emotional symptoms can exacerbate physical pain, and because of that connection, that mind-body connection. And so if we just focused on the physical symptoms, we wouldn't get very far. And so we focus on the emotional and psychological symptoms as well. And so that's part of what we're doing tonight. Okay, so a little overview of what we're going to dig into. Section 1, we're going to talk about social interests and social embeddedness. We're going to get an idea of what those terms are and why you care. And identifying and using your team, because teamwork is a big part of what we're doing tonight. Encouragement, there's an Adlerian concept the Adlerians in the house should be comfortable with, is the idea of encouragement. And so we'll talk a little bit about what is encouragement from an Adlerian point of view and how you can use it to help yourself and your loved ones and your patients. And then we're going to do an exercise together, sharing and listening, where you're going to get an opportunity to work with a partner to experiment with some of these ideas that we're talking about. And then a note for the sake of simplicity as we go, I'm going to throw out terms like, chronic illness or chronic disease or migraines or MS, and I'm talking about one big group of things. So if I just say MS, I don't want you to think, oh, well, she's not talking to me, she's just talking about MS right now, because the concepts that we're talking about are universal. So if I just throw out one example, I don't want you to feel like you're excluded, because we really are here to talk about all of these things. Okay? So then in section 2, we're going to talk about specifically to the providers about what is social interest and how I expect you to use it. I'm going to be setting a challenge for some of the providers here, because I think we've all been to a doctor's office or a healthcare professional's office and walked away a little disappointed with how we were treated. And so I'm going to give you guys some ideas on how to be a better provider and how to set better expectations for your providers. Encouragement versus sick role. Sick role is an interesting concept that we're going to talk a little bit about, educate you guys about, and how to overcome the sick role with encouragement. And then self-efficacy too, that self-efficacy being that confidence in your ability to achieve something, right? When we feel disempowered because we're sick, self-efficacy is the thing that we don't have. So we're going to talk about how encouragement can get you some of that. Self-management are those practical tools that we're going to play with. I promise some practical things that I've learned that you can learn to use in your own life or with your work. And then we're going to do another small group exercise of doing some goal setting, because I'm trusting each of you with a mission. Near the end of our time together, during that exercise, you're going to have an opportunity to list a few of your new goals, which are going to be based on the conversations that we've been having. And so there's changes that you'd like to make, either in your own life, well, yeah, pretty much in your own life, if you're a provider or a person with illness or a caregiver at any point. So I want you to be listening for those things. I want you to listen for an idea of, oh yeah, I kind of would like to maybe do that more, or do that last, that kind of thing. And so in our last exercise, you're going to be setting some of those goals and making a commitment to follow through with them to improve your lives and the lives of the people that you touch. So, and you will have someone to help you brainstorm some of these goals. So if you feel like, stuck, that's okay, because you're going to have a partner who's just as invested in you are as making this easy. Okay. And so as we go along the way, like I said, you might hear some of those goals. So you might want to jot them down on the back page or circle them if you have an idea, something like that, because we will come back to those. All right, and then section 3 will be kind of brief. We'll just have a conclusion, and then we're going to have a Q&A and a group discussion, because I'm going to get input from you guys. So that'll be fun. Okay, so now a quick, I want to do a little survey. First, I want to know a few things about, who's here? How many healthcare providers do we have in the house? Just so I can get a sense. Mental health, physical health, whatever. Okay, good. That's a good mix. How many people with chronic illness or physical disability? Quite a few. All right, great. Glad you guys are here. All right, and then how many people who are caregivers for a loved one with some kind of illness or disability? Yeah. How many people are all three, right? Yeah, quite a few of us. So there's a lot of roles to juggle, so that's helpful to kind of get a sense of what else here. And then the other thing that I want to know is, of those of you who are providers, how many are mental health providers? Okay, good. Any other kind of provider? Right, like I nursing. Any other kinds of providers of the mental health? Yeah?
Nursing.
Nursing? Okay. All right, cool. All right, and then how many Adlerians? How many know what I'm talking about when I'm talking about Adlerian psychology? Ah, good mix. Okay, good. That'll be fun. All right, so that's enough with the aerobics. There's your warm-up. Okay, feel warmed up? Okay, so now we're going to talk about Alfred Adler and Adlerian psychology. This is a brief primer. This isn't, a course on Adlerian psychology. But we're going to be using some of those concepts, some of those basics to inform our conversation for the evening. Okay, so Adlerian psychology is just one framework for understanding people, their personalities and their motivations, and how to help them. And it's the framework that we use here at the Adler Graduate School. We're also trained in other kinds of psychology, like cognitive behavioral therapy, and all the other basics. But our emphasis is on Adlerian psychology because it's got a lot of valuable tools that we use. So we're going to focus on some of these principles and how you're going to use them. Alfred Adler was one of the early theorists of psychology in the early 1900s, and he was actually started out as a physician. And he had a chronic illness or two of his own. So he's kind of familiar, or was kind of familiar with some of the things that we all have been dealing with. And so that's one of the reasons that he's a good person to go to for these ideas. Today, Adlerian psychology integrates the contributions of several other thinkers, expanding upon the principles offered by Alfred Adler, like Rudolf Dreikurs, his name is going to come up later. He's probably the most famous Adlerian. And those ideas that came from all of those different theorists, Adlerian thinkers, are kind of integrated. We're going to be talking about quite a few of those tonight. So if you're interested in learning more about Adlerian psychology, there's some resources in the back of your packet that you can look into. And the school being an Adlerian school, we have some information, like there's a booth over there where you can learn more about the school and its programs if you're interested in doing that. So the first Adlerian concept we're going to be talking about is social interest. So this is a key Adlerian concept. Social interest is that social feeling or that community feeling. Social interest is what gets you together with other people and want to share your story and want to hear their story. Any other Adlerians who want to say a little bit about what social interest means to them? Yeah, okay. Simple.
Giving to the greater whole.
Giving to the greater whole. That's a good one. Yeah. Part of that community feeling. And so not just taking, but giving. All right. Any others they want to throw out? Yeah.
Interconnectedness.
Interconnectedness. Exactly. Exactly. I'm a part of your life. You're a part of my life. We all depend upon each other. That's exactly right. Okay. Any others want to throw out? All right. So social interest, being a sense of belonging. All right. And Adler called this to see with the eyes of another, to hear with the ears of another, and to feel with the heart of another. That sounds pretty cool. I think we could use a little more of that in our society today, right? And it's basically this idea of feeling connected to and responsible for your community. And your sense of belonging in the community, the fact that there's something there for you. And people who are socially interested have a tendency to be more encouraged. Encouraged people, people who feel like they can take on the challenges of life, have a high social interest and feelings of belonging. People who are discouraged do not feel this community feeling, low social interest, and have a tendency to feel more inferior. So let's see, low social interest, discouraged, feelings of inferiority. That sounds pretty common when you're coping with chronic illness or disability, right? Because that's pretty discouraging. It makes you feel pretty inferior. So it's easy to feel depressed or get disempowered when you're dealing with these things. And that's where social interest comes in. And that's how it comes in to help us. Okay, so why are we going to use social interest? Well, exactly for that reason. Because it raises your level of encouragement. The solution to those feelings of disencouragement and inferiority is that community feeling. Social connection is the power in our power tools. That was our topic, power tools. It's the power in your power tools, is that social interest, that community feeling. So we're going to talk about how you can apply that to your circumstances because that's what's going to empower you. So for example, research shows that access to social support increases the likelihood of positive outcomes when you're dealing with health issues. And a lack of social support is predictive of long-term disability. And the adequacy of the social support and the quality of the relationships between, for example, the patient and the healthcare provider affects your confidence. Like I feel more confident when I'm confident in my doctor, right? And that affects your ability to achieve positive outcomes. So it's all about these relationships and this interconnectedness. Okay? So with social interest, we have some special challenges, right? Because managing social relationships is hard when you're limited in what you can do with your friends and loved ones. So what's an example of a limitation? Something that you'd like to do with your friends, but you can't because of your chronic illness or your disability? Chris?
I have vertigo, and so sometimes I can't go for hikes with my friends because I fall over.
Yep, exactly. Not falling over while hiking is a good reason to not go hiking, but gosh, it's not fun. Dar.
Managing energy or pain when your friends invite you out somewhere, whether you're in the middle of feeling awful and you can't get up, or you're afraid that you will, and that's going to ruin everybody's fun.
Yeah, we worry about that. And
One of my children has fairly profound autism. Taking him in social situations can not only be difficult for the people that are there witnessing his behaviors, but also difficult for him because anything is difficult for him.
so does that discourage you from doing things?
Absolutely. I don't take him as many places as I would like to.
Right? So it's harder on you and him. Okay. Any other examples people want to throw out? Chris?
Well, I have fibromyalgia with chronic pain syndrome. You know, I get friends inviting me out to go dancing or whatever. I don't get to go because I can't stand that long.
Right?
You know.
Yeah, I'd like to go dancing. Stupid foot keeps me from dancing, so I feel you, man. I think there was another one, right?
Yeah, I experience chronic headaches and chronic migraines, and so sometimes it's difficult to say go to the movies with friends or family. And for the most part, people are understanding, but in the past there have been some friends who haven't particularly been understanding the fact that.
And that is an excellent point. People who are understanding and people who aren't understanding. We're going to talk a little bit more about that later, so I'm glad that you brought that up, because that is really relevant. Because it is kind of disappointing and discouraging when you can't do the stuff that you want to do with your friends, right? Another special challenge is our cultural context. Here in the U.S., our dominant U.S. culture is focused on individualism, right? So that's things like we focus on independence, self-reliance, right? John Wayne, standing on his own. You know, if you want to be a man, I don't know why I'm using man references here, but if you want to be a man, you stand on your own 2 feet, yeah? Right? And if you're sick or there's something wrong with you, well, that's your fault. You know, the poor, it's their fault they're poor. The sick, it's their fault they're sick. That's part of our dominant U.S. culture. It's not entirely that way. I mean, obviously there are a lot of people like me who don't believe that that's true, but that's the messages that a lot of us who are sick feel, that it's our fault for being sick, okay? As opposed to a communal culture, some other cultures, including here in the U.S., like some ethnic groups, and then also around the world, where they have more of an emphasis on community. And if you're sick, then the community is sick. They see sickness as a community problem. My understanding is an example of this is the Native American tribes. When one person is ill, the tribe is considered to be everyone is ill. And so the community gathers around you because that's what they have to do. I mean, how could they not? It would be like not taking care of their arm if their arm was wounded. Not taking care of you would be the same. Okay? And so that's a challenge that we face in our culture, is this individualism that's dominant in our U.S. culture. Now, we Adlerians have a tendency to be a lot more communalist because we're really big into this social interest thing. And so I encourage you to become more communalist and hang out with people who are a little more community-oriented, people who are going to support you. Okay? Let's see. So how are we going to do that? We're going to talk about your team. Your team are the people you're putting them on your team. You're deciding tonight who's on my team. So your team might include your caregivers if you're sick and you need someone to take care of you. You know, these are like spouses, friends, partners, that kind of thing. Like I said, my husband and I are caregivers for each other, so we're on each other's teams. Your healthcare providers are on your team. Your patients, if you are a provider, those are your team. You know, they're not there for you, you're there for them, but by God, you better be on their team. And your social support. These are the people who aren't necessarily responsible for taking care of you, but they're your friends. You know, they're the ones that you want to be there for you. Your partner, your spouse, your family, and then it expands to society, community, culture. And a big part of important part of considering this team is imagining what it's like to be at the other roles. You know, putting yourself in those other shoes. Seeing with the eyes of another. So if I'm a patient, it's important for me to think about what it's like to be my caregiver. You know, because that's what a team does, is we look out for each other. It's not all about me, right? There's one stupid saying, there's no I in team, right? So if you don't know who is on your team, then your first mission is to figure out. Okay? So hopefully by now you at least have some ideas who's on your team. You might have some questions. Well, you know, so-and-so might be, so-and-so might be not. You know, that's okay. And people who can't be on your team, that's fine too. But it's important to know who these people are if you're going to when you're working with your healthcare providers, I need you to have a relationship with them where you express your needs, you ask your questions, you repeat the instructions you've received. Okay, so you want me to take that twice a day? No, once a day for 2 days. Okay, good. See, when you repeat that back, you get those corrections. Don't wait until your doctor's hand is on the door before you start asking your questions. Doctors hate that. They get their hand on the door and you say, oh, but wait. So make sure you ask them before they get to that point. And be candid with them. Sometimes it's hard for a patient to be honest if we're not doing our homework. You know, if I didn't take the medication that I was prescribed as regularly as I should have, or if I didn't exercise as much as I said I would. You know, it's better to be candid with your doctor about that. Or if the doctor prescribes something that didn't help you, you know, you're not there to please them. You don't have to say, oh yeah, I feel better, when you really don't. So it's important to be candid with your physicians, your healthcare providers, so that they know where you stand. Because it's entirely too easy for us to feel like, well, they're the ones in power, they should know, I'll just do what they say. No, you're in charge, I said so. Okay? Yeah. Okay, so when you're working with your team, you're also going to work with your social relationships, all right? These are the people who are going to give you support for your goals. You know that peer pressure, you're going to actually use it for good. So like, because getting social support increases the likelihood of change. 2 weeks ago when I was getting really stressed and I didn't want to work on my paper at all, I texted Sonia. Sonia, I can't get this done, what do I do? And so then every Monday and Wednesday after that, which were the days I said I would work on my paper, I got a text from Sonia said, how you doing, babe? How's the paper coming? Is it done yet? Need any help? Working on it tonight? She was great. And I let her know how I was doing, and she'd write me back and say, great job. And she even sent me a picture of her baby clapping for me. Right? Who could not write a paper when you're getting babies clapping for you on your text? Right? So that's what your team is for, is to give you that kind of support. To be there for you and to say, hey, when are you going to get that done? Because aren't you going to graduate sometime? The hecklers in the front row, exactly. Exactly. So, you know, you find that support and that encouragement helpful. Okay. And my other funny story is when I was working on my project last week, I was at the office. And every now and then I'd come out of the office and I'd just stand there and somebody would walk by, peg back in, and they'd walk by and say, what's going on, honey? I'm like, I'm so sick of this. I'm tired of working on this. I'm tired of the stress. And there was one time I came out and I went up to somebody and I said, I need some encouragement. And I said, I need a pep talk. And he turns to me and he says, yay. Like, that's what you got? That's my pep talk? And I said, that's what I got. I'm like, okay. But we laughed, I felt better, and I went back to work. So, yay. You know, if that's all you got, that's awesome. Everybody gives me pep talks. All right, so these are part of working with your team, okay? Then we talked before about understanding what it's like to be the other person on your team, right? Because as you need to be understood, likewise, you need to try to understand what it is like for the people around you. They have their own concerns, and they can't always share or understand our concerns, right? Hearing about pain is kind of a drag. You know, nobody likes to come to pity parties all the time. You know, every now and then you do need to just sit around and kibitz with your loved ones and go, gosh, my foot really hurts, and they can say, oh, I'm sorry, honey. You know, and then that's really helpful, but at a certain point, it's got to stop. You got to have some good times together, or what's the relationship built on, okay? And so if you're constantly being the one throwing all the pity parties, ask yourself if that's fair to them. Because while it's not fair for you to have to struggle with pain, watching someone else struggle with pain is also quite a burden. So be mindful of that. Okay, sometimes we talk about ourselves and our problems occasionally over much because we're seeking validation from other people. We want them to say, oh, you're right, that's so awful, or oh, I know that's so hard for you, or gosh, that's just not fair, or you're great, it's not your fault. You know, because we need to hear those messages, we need to feel those messages. But we can't always expect to get those messages from other people. Sometimes we need to just tell ourselves, it's not my fault, I'll be okay, I'm doing my best. You know, because if we're constantly seeking that external validation, that can be very draining for the people who love us. And so that's why we don't want to do that all the time. Okay? And be careful not to drive them away. It might be tempting to, unconsciously to push those people away, you know, maybe because you don't want to deal with them, you don't have the energy, and you don't want to feel like you're being rejected by them when you can't do the things that they can do. Maybe you want to prove that you don't need them. Maybe you want to prove that you're justified in feeling even more discouraged. See, if they don't stick around, well, see how hard it is to be me? You know, and it's tempting to fall into that trap, but it doesn't do you any good. It doesn't help you any, because because now you've just lost that social interest, that opportunity for community feeling that you could have had. Okay. So you're going to show interest in their lives, their problems, their needs, their goals. It's not all about me, my pain, right? You need to let them know that you're there for them as well. Like that saying 2 ears and a mouth. You know, we were given 2 ears and a mouth, and we should behave appropriately in that proportion. Do twice as much listening as talking. And when someone does something for you, I want you to express your gratitude. You probably do that a lot, but sometimes we forget. You know, when we have a caregiver who does things for us, sometimes it's easy to just get into the habit of, well, he always does that. I don't have to say thank you. I don't have to say please. Yes, you do. You have to say please and thank you. I said so. Because they're not your slave. They're your caregiver. They're your loved one. And you're there to give them nurturance just as much as they are for you. Maybe you can't do exactly for them what they did for you to express your gratitude, but I bet you can do something. You know, if somebody gives you a ride somewhere because you can't drive there, well, you can knit them a hat, you know, or something. You can do something to make up, to do your part, okay? So doing your part, reciprocity, okay? And you may have to accept changes in your social system. You know, there's maybe a new reality where there are people who just aren't going to be able to be there for you, that they're just not going to be a part of your life anymore. And that's okay. Just mourn that and move on. And stick around with the people who are there for you, okay? And with the ones who do stick around, find ways to make social time. Make those connections. Even if you can't, you know, go for the hike, you can't go for the walk, you can't go to the mall all day, you can't go to the movies, well, what can you do? What can you do that they enjoy doing? You know, can we all sit around and knit together? I can do that any day, right? So find the things that you can do and focus on those. And brainstorm with your friend. If they're willing to continue being your friend, they're probably willing to say, well, what can you do? What can we do together? And you don't have to be embarrassed about it. You don't have to say, well, I can't really do that because you're not inferior. You don't suck. You've just got something different that you're dealing with. And your friend would probably rather you be honest with them about it than make assumptions or them have to guess. You know, or you have to communicate through a non-communicative, non-direct way. Okay? So let those things be known. Okay? All right. So as you're working with your social relationships, one of the things that you get to watch for is getting the help we need, not getting the help they think we need. This is, we call it, it's the difference between being helpful and helpy. You know this word helpy, right? Helpy is when you're trying to be helpful, but it's not. You're being helpful because you want to feel helpful, not because you're actually helpful. My example for this is last October, my husband and I flew into O'Hare International Airport. And he had checked the box that says, yes, I'm blind, when we bought our tickets, because sometimes then they help you out, they get you from gate to gate, they get you ahead of the security line, you know, it's pretty handy. And when you're trying to steer a 6'2" blind man through one of the largest airports in the country, I'll take whatever help I get. But we get off the plane, and the gentleman there who's there to escort us to the next gate is driving a wheelchair. My husband's blind. He can walk. He's got a white cane that he uses to get around. And there's nothing wrong with needing a wheelchair, but he has perfectly good legs. And so if you put him in the wheelchair, now he can use neither his eyes nor his legs. And so it was helpy. It wasn't the kind of help that he needed. And what actually kind of made it really silly was the guy pushing the wheelchair was blind. I don't know what that was about. So we threw our luggage in the wheelchair, and then the blind man led my blind, seriously, I'm not kidding you, husband through O'Hare Airport at the slowest crawl you could imagine. We could have gotten there faster on our own. We were literally the blind leading the blind through O'Hare Airport. I was following behind them. I stopped and took a picture of the giant dinosaur thing. I'm like, no, go ahead, I'll catch up. Caught up. It wasn't that hard. They were moving so slow. So that's my humorous example of the kind of help that they give us that we don't need. And so we have to be direct. We have to be communicative. You have to be willing to say, no thanks, sir, I actually don't need the wheelchair, but here, we'll throw my luggage in it. That could be, you know. So if someone shows up with you, shows up for you with something that you didn't need, you know, and you can be grateful. You can say, thank you very much for the thought. But you can also be honest about, that's okay. That's all right. Okay, and some other examples of how you need to be direct in those communications are things like asking for time to talk. Like with your partners and loved ones. You know, sometimes you may need to say, hon, do you have a minute? Because I need to run something by you. And that's my favorite line, by the way. I need to run something by you. Because it's not, we need to talk. Right? Oh, it's I just need to run something I left my last job, I started the meeting by, I scheduled the meeting by saying, I just need to run something by you. And the run something by you was, I'm quitting. but I'm going to start with doom. I'm going to start with, oh, I just need to run something by you. So you can, and then we sat down and I told her I was leaving and why. So you still be direct, but you don't have to be scary about it, right? So ask for time to talk. Say when you don't feel heard. You know, that's a really tricky communication skill, and it's a good one. To be able to say to someone, you know, I'm really not feeling heard right now. Could you just repeat back to me what you heard me say? And if you repeat it back to me, and it's what I meant, well then, bing, now I feel heard, okay? And if it's not what I meant, well now I have an opportunity to correct it, and then feel heard, okay? So feel free to ask for that kind of stuff, okay? Avoid the temptation to be passive or manipulative to get what you want. It's tempting, especially when you're in that inferior, discouraged position. Because when you have no power, it's really tempting to find covert methods of power, like manipulation and being passive, lots of sighing, no, it's all right, I'll do it myself. You know, that kind of stuff. That doesn't help anyone. It doesn't help you, and the other person figures out what you're doing, they're just going to get mad at you. So be direct. Honey, could you go downstairs and get that thing for me? Thank you very much. You know? And it may be tempting to do those kinds of passive, indirect things because we don't want to communicate our needs. We don't want to be needy. You know, being needy sucks, and so we don't want to do it, and so we get all passive about it. But really, just use your social interest and use your communication skills, and if they're not great, then we're going to find ways to improve them. Okay? Now, a special kind of social team work that I want to talk about is patients and partners. If you have MS or blindness or whatever, and your spouse or partner has it as well, because they're part of that existence of having that. Okay? My husband is blind, and so therefore kind of in a way we're blind, which it leads to the blind leading the blind leading the blind through the airport. But when Michael was declared legally blind, our lives changed. Both of our lives changed in some similar ways and in some different ways. You know, he had to learn a lot of skills, like getting around the bus, getting around with a white cane, that kind of thing, learning to use a computer, learning to use a brailler, those kinds of things. And I had to learn some other skills, like making sure I shuffled my feet when I walked too close to him so that he would know I was behind him and not turn around and whack me accidentally. The cat even learned to make a noise. If he walked up to her, she'd say, meow, and he'd say, oh, hi there, just so she didn't get stepped on. The cat knows how to live with a blind guy. Okay, so do everything you can, by the way, to make your relationship as solid as possible with this teammate. Because if there's any crack in your relationship, a chronic illness is going to just spread it wide open, right? It will find that fault, that vulnerable point, and it will mash it. So you have to work really hard to make that relationship as good as it can be, all right? Encourage each other, acknowledge each other's efforts. We already talked about saying please and thank you, because they're not your slave, okay? So when you have a partner, I want you to treat treatment as a joint effort. You know, if at all possible, I want you to go with your partner to their medical appointments and go with them to, well, really all their healthcare appointments. Consider it as a joint effort, just like any other challenge in your life as a couple that you have to face. If you were broke, that needs to be a joint effort. You know, if something's going on in the family, the two of you need to tackle that together. If one of you is sick, then you need to tackle that together. Okay? Family support is an important component in recovery, and the family success in adapting to the challenges of the disease has been shown by research to maybe have a major effect on the individual's success of self-treatment. Okay, so this is why you need your partner's involvement. And if you don't have a partner or a spouse who can come with you to these appointments, then ask a friend. You know, somebody who's very dear, who would be there for you. And then someone you would be there for. Say that, okay, well next time you need someone to go with you to the doctor's appointment, I hope you know who to call. Okay? That's part of that, using that community. So going to appointments together is valuable when you're working as a team because they can hear for themselves from the professional what your limitations are for things like mobility, housework, going out, that kind of thing. It can be exhausting to try to explain all this stuff to your partner, maybe 1,000 times. But if they're there with you and they hear it straight from the doctor, then I think they're a little more likely to remember. Okay. And your loved one can help you remember which questions to ask, what the doctor said, what kind of self-care you're supposed to be doing, what those challenges are. So they can help you with all of that. they can ask their questions and participate as you consider options for treatment, which gets their buy-in to your treatment. So now they're on your team, they're on your side because they've had a say. And if you don't have a partner, again, just ask a close friend, family member, someone else who can be your teammate. Okay, so advocating and educating. Advocating, we know, is that thing where you try to explain things to other people, which gets tiring, right? It gets tiring being a public service announcement all the time. My husband gets the weirdest questions sometimes. And it usually starts with, can you see me? Things like that. So when you advocate for yourself, sometimes you have to educate the world. And sometimes you have to speak up and you have to tell the world what they need to do for you, okay? And if someone messes up, you can politely tell them what they did wrong. Like, no thanks, actually, we don't need the wheelchair. You can advocate for yourself when challenges arrive. For example, last month, I was without health insurance for 3 weeks due to a bureaucratic snafu. And for 3 weeks, I've been calling and calling and calling, trying to get someone that didn't know. We're asking for supervisors and never getting called back. And so finally I had it, and I called my state representative, who I have on speed dial. And I left a message, and the next day they made a phone call, and the day after that my insurance was reactivated. Call your state representative. They can do stuff like that. It's pretty awesome, okay? What else are they doing to get your vote, right? So feel free to use those kinds of resources. Make people do for you what they're supposed to do for you. When I was working customer service for several years, I learned that most customer service people, and not just like agents who answer the phone, but people at a desk, a doctor is a customer service person in a way, all of these customer service people, what they really want to do is help you. They want you to walk away happy. And so if your expectations and your requests are reasonable, if your demands are polite but firm, you don't know the amazing perks I've gotten out of Sprint just by being firm and polite. No, actually, I don't think you're going to charge me for that. Yeah, thank you. So just by being firm and polite, you can get what you want a lot easier. You catch more flies with honey than with vinegar. Okay? All right, so now we're going to talk about another Adlerian concept of encouragement. While I get some water. All right, the aim of encouragement is to increase an individual's courage to meet the problems of life. We were talking about how discouraged people have low social interest, low esteem. Encouraged people have higher social interest, higher mental health. So encouragement is to help you deal with those problems and raise your mental health. Okay? So there's those feelings of belonging. Socially interested people are encouraged. They feel like they belong. Discouraged people have low social interest and feelings of inferiority. Okay? Again, we said because they lack that community feeling. So encouragement is, what is encouragement? Because that word can mean a lot of things. When we Adlerians say encouragement, what we're talking about is positive feedback that focuses primarily on effort and improvement rather than outcomes. So encouragement is not praise, it's not empty praise, and it's not faint praise. It's not reward, and it's not language used to get what you want, to gain compliance. Okay? So unfortunately, this did not come out as readable as I'd like. But the language of encouragement, these are some examples that sort of contrast encouragement with discouragement and praise. So like the language of encouragement includes phrases like, well, I think you can do it. And you have what it takes. I've been hearing a lot of that the last couple of weeks working on this project. Okay? You're a hard worker. I could use your help. If we make a mistake, encouragement says, it looks like a problem occurred. What can we do to solve the problem? Okay? So discouragement, if you make a mistake, discouragement tells you, well, I told you to be careful. I knew this would happen. You always do this, right? Discouragement says, here, let me do that for you, because clearly you're helpless. Discouragement says, be careful, don't forget your assignment. You know, let me give you some advice. Let me give you some advice. Let me stand up here so you can be down here and feel all discouraged while I give you advice. Okay? Encouragement versus praise. Encouragement tells you what a lot of effort. You put a lot of effort into your work. Way to go. You're a fine person. And I know you did your best. You know, praise is based on outcomes. So you have to do well to get praise. Well, I'm proud of you when you did well. You did better than anyone in the class. Or, oh wait, no, you didn't do so well. So work harder next time. Right? So that's the difference between encouragement and discouragement. Encouragement and praise. Okay? Encouragement can be given anytime, even when things go poorly. If you did your best, that's all I ask. That's what I'm often telling my clients. I give them a homework assignment, they go home, they come back, they didn't do it, that's okay. How far did you get? What made it hard? You know, What can we do differently next time? Do you want to try again? How can we make it easier? That's encouragement. Discouragement is, well, you didn't do your homework. Who's going to go back to that, right? How's that going to help anybody? Okay, so now we're going to stop me blabbing and get you guys to get to blab. Okay, a little bit. So we're going to do an exercise where you're going to work in pairs. All right, called sharing and listening. So you will choose a partner, and I encourage you to choose someone that you actually don't know. Someone that you didn't come here with, someone that you've never met before. You're going to be sharing your story and getting some encouragement back. All right? Now, if you aren't comfortable working with someone you've never met before, you'd rather share with someone you know, that's okay. Someone's here, work with them, that's fine. I just encourage you to try it with a new friend if you can. Okay. Now, this new friend is going to have a fresh perspective, so that's part of why we want to do that. So when I let you know, not yet, I'm going to tell you a little more about it, but when I let you know, you're going to find your partner, and if you don't have a partner, and we can spread out in this area too if we need to, and you're going to find your partner, and if you can't find a partner, you're going to raise your hand, and then I and my talented team of people are going to make sure that you have a partner. Okay? So, or you'll just look around and you'll see another raised hand, and you say, oh, okay, my new friend. Okay? So it's that easy. And if you want assistance with this process, if you need a little extra help, again, this is part of being direct, right? Being direct with your needs. Then you just try to get my attention, get Patrick's attention, Marina's attention, Michael's attention. One of us will make sure that you have a partner. Okay? All right. So what you're going to do is you're going to have 5 minutes as a talker and 5 minutes as a listener. Okay? So talkers, you're going to be talking about what brought you here. So people with chronic illness or disability, what are you dealing with? How does it interfere? How have you succeeded? What have you overcome? What are you still working on? Caregivers, kind of the same story. Who are you caring for? What's hard about it? What do you want to do instead? Okay. Healthcare providers, what kind of care do you provide? What kind of challenges do you face? What are you working on overcoming? So the point is to be able to share during this time to your listener. Listeners are just gonna listen. You're gonna use your active listening skills if you've been trained in those. Draw out the person. Give encouragement. We talked earlier about encouragement, the difference between encouragement and praise. Now's your chance to practice. And you have it in your notebook if you can't remember what the difference is. And for now, I don't want you giving any advice or any suggestions for trying to fix it. One thing that we caregivers do a little too much is try to fix. I get in trouble for that sometimes in supervision. Okay? So for now, you're just there to listen. Okay. So now I recognize that for some of you, sharing your personal story in an environment like this can be kind of uncomfortable. That's fair. Just share whatever you're comfortable with. You know, if you're working with a totally new person or a complete stranger or someone that you've known your entire life, just go with whatever you're comfortable with. The more you're able to share, the more you'll feel heard, the more you can do. So you get out of it what you put into it. But I don't want anyone feeling like they're on the spot. If you just want to sit and talk about baseball for 5 minutes, I will not fault anybody. Okay? So this is here to work for you. But I do encourage you to try it for your own sake as well as for your partner's sake, because they're here to learn too, and so they can learn from you. So a word about confidentiality. You know, if we were clients, if you guys were clients in my, we had an entirely huge group of clients. But if you were my client, then we have a relationship where I have to respect your privacy, and I don't talk to other people about what's going on. Okay. Now, in this environment, I hope that we will all give each other that same respect and that same privacy. Okay. What we talk about here stays here. You know, it's not as shiny as Vegas, but we didn't have to go there either. Okay. So what happens here stays here, and because we're all going to try to give each other that trust, I hope that will make it okay to share. And that happens a lot of times in this school. When you go to therapy school, you get therapized a lot in your classroom. You get together in little pairs and you therapize each other because who else are you going to do it on, right? You can't do it out in the world, so you got to do it each other. So those of us who've gone to therapy school, we're familiar just sitting down with a complete stranger and telling them our life stories. You know, and if you're not comfortable with that yet, that's okay. Just share what you can. What's that? Some of us are Minnesotan.
Yes.
Exactly. Exactly. Yes, I was thinking of the Minnesotans when I wanted to make it clear that if you want to talk about baseball, it's okay by me. Okay? All right, so you're going to choose a partner. And before we start, any questions on this exercise? Anybody know what they're going to do? All right, fabulous. Okay, so let's see. You'll have 5 minutes. I'll give you a 1-minute warning. You'll be sharing your story and hearing their story. And that's the idea. So here's a reminder of what you're going to be talking about.
Wait, you get 2 sets of 5 minutes?
2 sets of 5 minutes. 5 minutes and then you swap. Thank you for the reminder. Okay, so I want you to do your parent up now. Feel free to pull chairs out there if you need some more space. Make a new friend. If you need to find a new friend, raise your hand. Find somebody. Now's your chance to do it.
So somebody else brings friends.
Sure. Are you wanting to go with someone you don't know?
Yeah,
That's fine. You know him?
Yeah.
Okay. Do you want to come? Yeah, sure. And I can do it. I'm Lori. I'm Jeannie. Nice to meet you. I guess I'll be
What if I
I come to a lot of so I just need all of the concepts are there. So I'm excited to go back. And that encouragement that can be different. That's all. Did you raise your hand? On all three. So, you know, just to let them know that right. And that does not mental health being helpful with it. Especially if they do so hard for
I know. So it's ongoing. This is a lifetime issue.
Oh, yes.
To take the first step. The first time.
doesn't work like this.
One minute left for this conversation. Keep going.
I kind of have
medical doctors and
a lot of people forget that caregiver really just has to take care of I did it when I realized that,
to be
say, what can I do? Let me run your quiz. Helping with so, but yeah.
Alright, now I'm going to have you switch roles. If you were the talker, now you get to be the listener. If you were the listener, now it's your turn to be heard.
Yeah, with what's yeah, because it's like
and I really something that was regret. So that's what I'm trying to look at. And there's not
I believe I don't know I remember when I so I brought that to the table, knowing that just having these workshops. I've sent so many people to like workshops. It's like if I have a friend or find a caregiver,
that's what I'm looking
you know,
yeah, exactly. Most anxious point in my life so far. It's something that I really been because of that, there's a lot of expectations that I have on myself for performance, and so and I know this is how you that's going to be the best like the program for me.
other people are really that are appreciate a lot of it is that kind of story like, you know, gives them some more people. That is just it's the highest.
It's important as I feel like I can help somebody else perform better than myself. Because of what she was talking about, being passive and not asking for later. I've always asked people to take a step back. Okay. What do I need to
push them aside.
You know, people always just encourage that side of it. Girls like, oh, you're so helpful. And I love that. That's kind of what I love. Just know love to see our sensitivity. Well, it's my sister. And my dad also has anxiety. That's what brought me to the substance abuse because my and so their dad is
because I'm thinking it's hard like a lot of we also trying to
Alright. I invite you to return your attention over here.
Well, then we shouldn't again.
Okay. Good work. I see a lot of nodding, a lot of talking, a lot of laughing, smiles. Excellent. Good work. Alright, fabulous. I can hear a snippet here and there. Good stuff. Okay. Thank you. Very good. Alright, so now we're going to talk some more. We're going to come back to this. Remember, you're going to meet again with your partner a little later for a few minutes. But for now, we're going to move on to talking about social interest for providers. Now, I'm going to breeze through this section a little faster than I originally intended because I've been having such fun yapping away. I'm a little over my time right now. And since everyone here who is a provider, as far as I gather, is either a mental health provider or a nurse, and I trust nurses to get the kind of education that we get on how to connect with your patients. They're some of the most compassionate people that you meet. So I'm going to breeze through this a little bit faster than I would otherwise. But if you ever have any questions about any of this stuff, really, you can always contact me after, okay? All right, so again, for providers, you're going to be teaching your patients. Patients are going to be teaching your providers to take advantage of some of these social interest skills we've been talking about. Establishing trust with your patients increases their compliance, working with their patients and their learning style. Things like if they need something written down, I'm very much a visual learner, so I need my doctors to let me write things down or to write things down for me. That kind of thing. Don't talk at a patient, engage them. Make sure your patient is able to listen and learn. Don't wait until they're on the table and you have a needle in their back before you tell them what to do when they get home. That actually happened. Resistance is a misalignment of goals. We providers sometimes have this idea that resistance means, well, the patient's not doing what I told them to. Well, clearly they are resistant. And what resistance means is my goal was different from my client's goal. And, well, it's really about them, so which one of us needs to change their goals? Okay. Building relationships with other providers is an expectation that I have for all of you professionals for case management. You know, return phone calls, exchange notes, get the word out, talk about your case. You'll get a lot of perspective when you talk with other providers about your case. And helping your patients build social interest using all of these principles that we've been talking about. Ask your patient, who's on your team? Does your partner come with you to your appointments? Invite your patient to bring their partner with. Okay. So social encouragement versus sick role. Okay. So sick role is this really interesting concept. And someone who's taking the sick role is someone who's feeling really discouraged. Sick role is a kind of discouragement. It's a kind of feeling disempowered. The sick person feels helpless, like they can't contribute to the world or themselves, even for that matter. They solicit attention for their illness behavior. They might act helpless. They might complain a lot because that's how they know how to get attention. Sometimes this is sort of derogatorily called the victim mentality. I don't like that phrase, but I mention it because it does cross some people's lips. To me, that's blaming the victim, and I'm more about empowering the victim, and so I don't like calling it a victim mentality. It's a sick role. It's a clinical idea of what it's like to be so discouraged that your only avenue to power is to be even more discouraged. Okay?
Thank you for that.
You're welcome. Okay, so the sick role and illness behavior is a tempting trap. When you feel weak, sometimes you will find whatever avenues of power you can. Okay? And I'm not saying that we all do this victim thing, victim mentality, but we all face the temptation to find significance and attention through playing this role. To use your illness, pain, or disability as an excuse to avoid something that you don't want to do. It's possible for people around us, unfortunately, to accidentally contribute to that because they're being so kind and so loving and so caretaking that they do for us too much. Like, oh, I'll go get that for you. No, I didn't need you to get that for me. I could have gotten that for myself. And then how does that make you feel? That makes you feel more helpless. So while I'm encouraging you to work as a team, you also need to let your partner or your loved one do for themselves what they can do for themselves. Because if you do something for them that they didn't need you to do, you've just given them the idea that you don't think they're capable. And maybe they should think they're not capable too. Okay? So while you're acting, coming from a place of loving and thinking that you're being encouraging and helpful, you're actually hurting them. So that's something to be mindful of. It's not on purpose, I know. But you guys know what I'm talking about. Everybody we know. We all know somebody who either we've fallen into this role of the sick role, the victim mentality, or we know somebody who has. We've heard the complaining, the excuses, the whining for attention, that kind of thing. So what do? Well, we choose not to give in, okay? Instead, we choose to find other avenues to significance and meaning. And that's through encouragement, okay? So caregivers, I'm going to expect you to encourage the people that you take care of. And do for them what they can do for themselves. Be warm, be supportive, be helpful. Give them the help that they need, not the help you think they need. Remember we talked about that. Okay? Don't unintentionally reinforce that sick role behavior. When they do something for themselves, say, that's great, look, you did that on your own. Look, you got from there to there. You didn't even need me at all. Okay? So that's giving attention and social reinforcement for wellness behavior instead of for illness behavior. Okay? Healthcare providers, I want to remind you that you can accidentally reinforce this sick role behavior by recommending things like excessive tests or excessive treatment. Maybe you're just trying to be thorough, but if you convince your patient that they need all of that, then they feel like they need all of that. Okay? You're reinforcing that sick role. On people with illness, I want you to make it clear to your caregivers and your providers that you're trying to stand on your own 2 feet or whatever as much as you can. And please don't do for me what I can do for myself. Please help me stand up. Okay? If you're feeling unable to get your needs met, we talked about how you might be tempted to use things like manipulation, or other kind of behaviors to get those needs met. But if you're having trouble getting those needs met through directness, then I want you to work on those soft skills, things like communication, conflict resolution, positive work, those kinds of things. Assertiveness, problem solving, other relationship skills. And if you are having trouble doing that on your own, find books, talk to a mental health professional, look for help from somebody who can get you unstuck with this so that you can be more satisfied with the results of your health care and the people around you can help you with that too. Okay? So, we're going to talk about attitude, expectations, and subjectivity. All right? Attitude, like they say, a positive attitude helps. Okay, so you're going to manage your expectations. Is it good enough? Maybe it's not perfect. Maybe it's not the best. When I got from here to there, did I stumble a little bit? Yeah, but I got there. Okay, was it good enough? Doesn't have to be perfect. Some of us are recovering perfectionists, right? So I'm learning to accept good enough. And if I can do it, by God, you can do it. Okay. Don't sweat the small stuff. That's the saying, right? Really, literally, don't sweat it. It doesn't matter. If you have an illness or if you treat illnesses, then you've probably got more perspective than a lot of people who don't. And that perspective should empower you to know that don't sweat the small stuff. It's not worth it. Okay? You've probably heard of the serenity prayer where we ask for the serenity to accept the things that I cannot change, the courage to change the things I can, and the wisdom to know the difference. And this concept is found in a lot of different cultures and religious texts. So it's a concept of just having that wisdom of, well, can I change this? No. Okay, then how do I live with it? All right? Managing your expectations. That's what we've been talking about. Okay. Can you manage the problem instead of have the problem? All right? Focus on managing the problem. We talked at the beginning about I suffer from, I control, I this and that. Okay? Reality is as you perceive it. Choose your thoughts and emotions. Your emotions come from your thoughts. It's hard to choose emotions, but you can choose your thoughts. Your emotions are the results of your thoughts. So meanings are not determined by situations, but we determine ourselves by the meanings that we give to those situations. So we can either be disappointed when something didn't go well, or we can be happy that, well, we got half there. Glass is half full, half empty kind of stuff. And research actually shows that these kind of attitudes make a difference in health outcomes. Find meaning in things. Determine your own meaning in things. If something is a disappointment, well, if you fell down, well, how's the view from here? Oh, look, a flower. I mean, it's kind of cheesy, but you can either be happy that you found the flower, or you can be mad that you fell down, or If you're having to follow somebody who's slow going up the stairs or whatever, well, take time to admire the wallpaper. Have a Zen moment. If you're the slow one and you're frustrated by that, that's okay. You know, it's not the end of the world. It's all right. A little perspective. Okay? And again, if these concepts are like, what? You know, that sometimes it kind of sounds like it's being oversimplified. But really, if you just try to open your mind to it a little bit, be a little positive, and it kind of snowballs. Okay? So, self-efficacy. Self-efficacy is that feeling, I think we mentioned it before, that you can accomplish something. It's your ability to achieve. Now, when we're discouraged, we don't have a lot of self-efficacy. We don't feel like we can achieve things. All right? It's related to the feeling of control, and it's related to health outcomes. If you can feel like you can do it, you are more likely to achieve it than if you couldn't, than if you didn't feel like you could do it. Wow. A lot of research has looked into this. Okay? So, higher self-efficacy, we get into this, can yield to less disability, less pain, better outcomes, and better functioning. Okay? Now, this is not just because you're actually better at achieving these things, but because the higher efficacy decreases your stress, and lower stress is better for your body. All right? So how do we get efficacy? How do we get self-efficacy? Well, it's part of it is that positive attitude. Count your resources, count your blessings. For a while there, I was feeling like, okay, well, there's 3 resources in life. There's time, there's money, and there's energy. And I'm a grad student. I got none of those. And so I'd be confronted with a problem, and I'd get really frustrated. I don't have any time. I don't have any money. I don't have any energy. Well, I forgot. I have people. I got lots of people. I got awesome people. Okay. So if you focus on the resources that you don't have, you're not thinking about the resources that you do have. Okay. So be prepared to look into those, count those, think about it. Ask a loved one, what am I missing? Okay. Have the courage to be imperfect. That's a favorite Adlerian saying, right? I'm seeing some nods, right? We Adlerians like to have the courage to be imperfect. Like I said, I'm a recovering perfectionist. So having the courage to be imperfect by standing here and occasionally saying smart things and occasionally saying things that come out wrong. It's courage to do that, okay? All right. And what else? You want to exercise power over what you think and feel. So you manage your self-talk. Those are the messages that go through your head. Like, I suck. I never get anything right. Those are the kind of messages that we want to do something about. And if you can manage those on your own, challenge those negative thoughts, great, because you'll feel better. If you have a little trouble with that, again, that's when you might want to talk to a mental health professional about getting a little help managing those. Okay? Congratulate yourself on your achievements and practice gratitude. You know, for example, achievements, I mean, here you are, for one thing. Some of us overcame disability or illness just to get here, just to spend the evening here. Some of us might find it difficult to sit in a chair for an hour and a half, or to get here when they can't drive, you know, those kinds of things. Or to carve out the time out of a life that's already filled with a half a dozen other things that are difficult to do. And yet, here you are. You made the time, okay? So to me, that says that you can do it, that you can achieve things, okay? So we're gonna talk some about self-management. All right, managing your illness. We're gonna start with a couple of tools that I developed myself in managing my illness that I wanted to share with you. The first is the personal health care journal. Now this isn't complicated. It's nothing I can patent. It's not fancy. I'm not making it up to be anything that it isn't. But it is important. Okay? It's a tool that you can use to keep track of things. Like as a healthcare provider, I'm educated and trained to take notes on every encounter that I have with a patient. And so it occurred to me, well, I could do that when I'm the patient. You know, I'm a really good note taker. Anyone who's had a class with me here knows that. Okay. So I became my own documentarist for my own healthcare. So I have my journal, and I have records that go back to 2007. Yeah. Every doctor's visit, every physical therapy appointment, everything. Oh, hello. That's fun. I must have hit a button. Thank you. Wake up. That's the wrong one. Look at me, having the courage to be perfect right now. Sweet. Oh, fabulous. That's going to be great. And nothing is more fun than trying to use somebody else's computer in front of a room full of people and do what you're trying to do. Oh, we're close. We're close. Okay, there we are. Now go straight to that one. Yes! Okay. Good job. Good team. Okay, so this is my journal, right? Okay. And, okay, now regain train of thought. Okay, so before your appointment, you can sit at home and you can write down your questions that you have for the doctor. You can write down the problems that you're having, the challenges that you're dealing with, that kind of stuff. Because we always forget that stuff when we get to the doctor's office. You get in there, you get your 3 seconds, they walk out the door, and you go, oh, I forgot to ask him about the medicine. So what you do is you write that down in advance. And again, you're going to use this, you're going to teach your patients to use this, okay? You're also going to add your comments, your concerns. You're going to document your symptoms. I had 2 headaches last week and 3 the week before, but that's less than I was having the week before that. You know, that's useful information for your doctor. And you can update your list of medications. Like I got a little pocket that I keep my list in here. So I'm one of those nutty organized people. I showed this to a client once, and she said, "You kind of crazy." I said, "Yes, but I promise only to use my powers for good." And that was the inspiration for this talk, actually. I was kind of wrestling around trying to figure out what I wanted to do. And I realized, hey, I need to show this to other people. Okay? So when you're at your healthcare office, you're going to document the conversation. Get your questions answered and write down those answers, okay? And you can have someone else fill it in for you if needed, like your partner when they come with you. A dear friend came with me to an appointment once, and I was medicated and couldn't make my own notes. And so she wrote the notes in my book for me, like when they were checking my blood pressure and all that. And I actually get a little misty when I look back at that and I see her handwriting in my book. Because, I mean, that's love. She came with me and wrote that stuff down, okay? So that's the kind of social interest that we're talking about, okay? Now, the other thing that we're going to talk about is the flare-up protocol. Michael's going to hand out samples of those. What the flare-up protocol is a tool, well, what a flare-up is, when your illness or your pain gets worse, like we usually don't have a baseline, okay? But then at some point, it suddenly gets worse. You know, you get maybe, for me, it's a migraine. So this flare-up protocol is based on my migraines, okay? And so when that time comes, that's a time to make decisions. You have to do things. You have to take care of yourself, okay? So you're gonna, but it's a difficult time to do that because you feel crummy. So at the time at which you most need to be able to think of how to take care of yourself is the time that you most feel incapable of doing so. And I was getting really frustrated with this. So I made for myself a protocol. A protocol is a medical term for a guideline for treatment. It's what you do when something is wrong with the body, okay? And in this case, you're going to write it when you're healthier so that you can use it when you need it. And okay, so I want you to start by looking at the side that has more words, okay? Rather than the side that has more lines, okay? And this is basically a watered-down version of, of an example of what I do when I get a migraine. This is my protocol. It reminds me to take my meds, to drink water, to call my doctor, to do the things that I need to do to take care of me because my brain isn't working. I'm not going to remember to do that on my own, okay? And then once I've done all of those things, well then what do I get to do? Do I feel up to going to work? Do I feel up to reading? Or do I feel up to petting the cat and knitting? Is that what I've got today? So it's a reminder of those things because I started to feel like all I was doing, I was having 6 migraines a week for 8 weeks. And I started to feel like all I did was lay around. And that's pretty discouraged. And so that's a big part of where this came from because I got tired of laying around. Well, what can I do? And so this protocol reminded me of what I could do. Okay, so it's my gift to you that you have your own protocol. On the back, there are blanks. And like I said, this isn't fancy. It's not that I'm going to copyright, but it's just something that I developed that I want to make available to you. So that when you are well, you will fill in, well, what flares up for me? What do I need to do to medicate it, to take care of it? At the bottom you can see there's a little asterisk, for call family and friends. So reach out for that social interest. Sometimes when because I'm like 99% on the extrovert scale, I'm weird when I have a migraine, I actually want to be around people. It's very bizarre. But so I'll call people. I've gone to parties with a migraine and people are like, what are you doing here? Like, I'm just soaking it up. Y'all just go. I'm just soaking it up, okay? So if calling somebody helps you feel better, do that. Call your mom and talk about what you're doing, okay? So that's what that protocol is. Okay, so we're going to talk about being proactive, why you need to be proactive. You need to invest yourself in your care and your treatment. Again, I'm going to breeze forward a little bit. You're going to break that negative cycle from feeling bad, I can't do anything about it, so now I feel worse, okay? So now you've got things like your protocol to help you, so when you feel bad, you can take positive steps, which will actually make you feel a little bit better. And it's just a little bit. You don't have to magically feel out better. It's a snowball effect. The more you take care of yourself, the more you'll feel like you can take care of yourself in some personal issues, people in psychological pain have a tendency to report more physical pain. So if you're dealing with head stuff, find a book, find a friend, find a me, find a therapist, get some help with that stuff, okay? Facing the things in life that you do not want to will change your pain. You told me that. Yeah, you can blush it, okay? So look after your health. You're going to engage in health prevention. You're going to change your health risk behaviors. Maybe that's a goal you want to set tonight. Maybe you're going to say, I'm going to quit smoking. I'm going to deal with my high cholesterol diet, okay? You're going to be an active participant in all the ways we've been talking in your health care, okay? You're going to be proactive. Another way is everything you have to give up, I want you to replace it with something else, okay? Like my example was I had tendonitis in my wrists last winter because I was making a lot of Christmas presents, knitting a lot, and I got tendonitis and I couldn't knit anymore, and I got really bummed. For one thing, I didn't get all the Christmas presents finished. But I had just been taught by a friend on how to spin yarn. You take this fluff, and you have this thing called a spindle, and you turn it into yarn. And you spin it, more yarn, spin it, more yarn. And I had just learned how to do this from a friend. And that did not hurt my wrist, because it was a different movement than the knitting was. And so in 2 months, I learned to be like a fantastic spinner. And so I lost something, but I gained something new, okay? A colleague of mine talks about how she had to give up weightlifting because of her chronic illness. And so now she does the recumbent bike. And she loves it. It's fabulous. She's just as happy as she was when she was weightlifting. And she feels better because she found an answer. And now I can spin, right? So it's all about finding meaning. Focus on what you can do, not on what you can't do. I want you to focus on improving your coping skills, stress, the way people cope with stress, important roles and outcomes, okay? All right. Sometimes we like to deny or avoid stress. Watching TV does not count as coping, okay? You have to actually learn how to cope. You have to get enough sleep. You have to talk to your people, talk to your team. You have to do your relaxation techniques. You have to learn to do things that are fun. If you don't have things to do that are fun, you find things that are fun. Stress itself has negative physiological effects, even for healthy people. We all know that, right? So if you put stress on a body that's not healthy, that's chronically unhealthy, well, dude, you got to deal with your stress, right? Okay, so improving your coping skills with things like relaxation, mindfulness, meditation. For me, I found Tai Chi and yoga to be super helpful. I'm not the person who can sit there and meditate for 5 minutes. It just doesn't work. I get bored. I'm thinking about 15,000 things a second. But Tai Chi, I learned to focus and maintain focus. And it's also taught me a little bit about my physical body as well, okay? So these kind of techniques are helpful for stress management, stress relaxation. You get a sense of empowerment out of them. I found a great community through the Tai Chi and yoga people that I work with, okay? One of my Tai Chi friends is here, okay? So there are plenty of resources out there where you can look into this stuff. So I can't go into it in depth, but I want you to look for it. Okay, that might be one of your homework assignments, right? One of your goals, okay? So for exercise 1, you should say 2. Exercise 2, it's about setting your goals, okay? So we're running out of time, so we're going to spend a little less time on this than I wanted to. So you may want to do this some more with somebody at home. But I do at least want to give you each, let's say, 2 minutes, 2 and 2, that's what the yoga instructor says, 2 and 2, 2 minutes to work with your partner, talking about setting goals, okay? So your talkers are going to be sharing 3 or more changes that you want to make from all the ideas that we talked about. Maybe brainstorm a little bit. You know, your listeners, you've heard what this person is going through. You've got a 5-minute idea. You're not an expert yet, so you're not going to try to fix it. But you might have some ideas, some suggestions, okay? And if you come up with more than 3 ideas in this little bit of time, then you're going to star a few. Make those your priority. You're going to talk about obstacles and maybe do a little brainstorm. So we won't have a lot of time for this, but I think it's important. So if you don't get enough out of it here, I want you to go do it somewhere at home, okay? If listeners, your job is to brainstorm, suggest resources, and encourage. We've been talking about encouragement. Okay, so there's your short example of what you're going to do. So ready, set, go.
All right, here we go again.
Just wanted to pick one.
First study. Okay.
I really want to get back on the exercise regimen. I used to be very faithful and I felt so. So I've done everything in my like that better, you know? And since I've gotten a little bit, I just feel sluggish and
Right now.
whatever. But I just noticed, like, my world is not right. Like I used to be. And I've given myself permission to graduate. You know,
I'll practice
either maybe do it on another, right, or do it again from it, or to another workshop. One I've already done it. But again, I just,
Then you're like,
so, what thoughts do you have?
Okay, no, that wasn't enough time to switch partners. I know, I'm sorry. You can stay after.
but I want to tip something
Alright, good job. That wasn't enough, wasn't it? Right? You thirsty for more of that, okay? I want you thirsty for more encouragement, more goal setting. Okay?
all 11 of their married
Alright.
spouses and kids.
I'm sorry, I know that wasn't enough time, but I'm glad that I left you wanting more. Okay? Okay, good job. Alright, so now we're going to start, we're in the home stretch game. Okay? Section 1, well, you were there. Section 2, you probably remember that. You got some notes, lines and things, that was good. Emerge a resource which can get stuck on issues. You can consider things like health-focused counseling or health-focused psychotherapy. That's part of what I provide in my practice. If you need to find someone, you can call your insurance company and tell them you're looking for this specialty. They should provide that for you. If you don't have insurance, there are a lot of therapists out there who are willing to work on sliding scales. There's some books you can look at. Patients and caregivers can look into these books. You've got the list. Some other resources specifically for healthcare professionals, including one of the books that I read for this project. And then some things that are just useful for everyone, okay? So you can look at these at home, okay? Some more good stuff. 4 slides worth of everything that I read for this project. and I'm grateful to these scholars for putting this stuff together because I certainly couldn't have invented all of it. Okay, I like this canoe. In the depths of winter, I finally learned that there is within me an invincible summer. That's cool. That's what we're doing here. Okay, so I wanted to have more time so that we could chit-chat. If anybody needs to go now, I totally understand. But I would like to hear any questions, any comments people want to throw out, resources that I haven't mentioned that you would like other people to know about, those kinds of things. Sonia.
In your furthering resource books, you have a lot about living with pain and struggle. Do you have anything about family members with depression? Because finding a support group for, you know, my husband has depression. Finding a support group to help me, help him, very impossible.
That's a great question. I don't have a good answer to that. Does anyone here have a suggestion? Okay.
Pathways Minneapolis
Yes.
is both for people with health crises and for caretakers. And you walk in, it's totally free. There's no question of why you're there or what your insurance is. If you walk in, you must need to be there. And it's all by professionals. It's not by internists or students trying to play around to see if they can figure out what they're doing.
Learning to therapize.
Yes, yes.
Like what you're doing. Excellent.
That's great.
Pathway. Okay, good one. Thank you, Deb. Yes.
NAMI has support groups, not just for people with mental illness, but also for family members.
Say more about NAMI.
NAMI is the National Alliance for Mental Illness, and they advocate, they do a lot of legislative work, and then they also put together groups, help people have support groups for families, caregivers, for people with different diagnoses, and they're really good about having a lot of people with mental illness on their boards, in their staff, all that.
People actually know what it's about.
Yeah.
Great, thank you. Okay. Any other comments, questions, resources you want to throw out? Okay.
I wanted to, one thing that came up for me is when you were talking about encouragement and discouragement. There's this, and you said, wow, you did that for yourself and you didn't even need my help, or whatever. Personally with me, I have some pain issues sometimes and whatever, but they really don't get it. What I don't like is a statement like that when I've done something, especially if I feel capable of doing that.
Right, don't treat it
It's
like
like if I've done something that's like beyond what I'm capable of.
Yes.
Yeah, knock yourself out.
Right.
Tell me I'm great. But if if I made you dinner, and I'm capable of that even though I'm hurting, you don't need to go overboard about it and like I didn't need to help you.
Yeah.
It's like sometimes it feels condescending to me.
You're right, that's a very good point. We got to find a balance, and it's really good to communicate that back to those folks. If they're giving you that kind of feedback, you can say, I realize that you're trying to help me and I appreciate that, but actually it makes me feel kind of condescended to it. I know that's not what you meant. So can we find a better way for us to have that communication? So good one, thank you very much. Any other thoughts, comments, resources people want to suggest? Deb?
Yeah, when you were talking about sick roll, and as someone with chronic illnesses, I sometimes question myself rather than having other people question, well, are they just milking this for all it's worth? It's like, well, am I really this sick? Can I really not get up today? What is my problem? Come on out. And the tendency is to push yourself and go beyond instead of pacing or doing whatever to do yourself.
Yeah, you do need to respect your own limits.
And
absolutely right.
how do you do that effectively? I mean, what is the self-talk that you need to give yourself to eliminate that possibility and feel secure about that?
I think one of the places that I would start would be again with my team. The people who know me and know what I'm capable of, and the people who I trust for an honest reaction. Am I sounding kind of whiny today? I don't know if I feel like I can do this or not. What do you think? So, and also your healthcare professionals, those people who are supposed to know So consultation with those people, if you trust them and they can give you those kind of support, then that'll help you build the confidence to know when you really do need to take a break and when you really do need to push yourself. So that would be my first answer. Does anyone have any other suggestions on how to deal with those situations when you're questioning whether you really do need to take that signal risk?
Well, I guess one of the things that I have ended up saying to myself is that who I am really? You know, is that everybody has their whiny days, but when I am saying to myself too much, you have to push yourself, you have to do more of this, and I am finding that I have pushed myself and done more of this and been completely exhausted by the end of dinner every single day, then I end up saying to myself, now come on, is that really who you think you are? That you are going to be in that role all the time, and you have to push yourself so hard every day just to prove to yourself
I did
that
it
you're...
for a number of years.
Oh,
Why
yeah?
can't I do it now?
Yeah, I know.
Yeah.
It's that sort of.
And other people will get in and get frustrated with you for pushing yourself so hard.
Yes.
Oh,
Yeah.
why did you push so hard, and oh, now you're so worn out, and hon, why didn't you take a break?
Right,
And, you know, and I...
And you should know better.
Yes.
Because you're a nurse.
Oh.
You know, you're on the other end of that.
Yeah, we got a should in there too.
Yes.
You know, you've got the
Time,
healthcare background, so you should know
You
better.
should know better, right? Yeah, you're right. These are just hard
When
questions.
we're in the healthcare field.
I think so too.
Yeah, even we don't know. Yes.
I think sort of going back to what you were saying, is it being as compassionate to yourself as you would be to someone else is a big thing that I found helpful, because so many times we're so much harder on ourselves. We have such higher standards for ourselves than we would for someone else. We push ourselves so much harder than what we would ever expect of someone else. Just in general, but also people, you know, who experience chronic pain and think, oh, well, this person, my family members, you know, my friend can do this. I should be able to too. I should be able to overcome this. I should be able to surmount this. And judging yourself by another standard is so unfair to yourself. So it's just, like I said, being as compassionate and kind to yourself as you are to others is really important.
That's great. Thank you for that. Bethany, I think, did you have something?
Well, this is in relationship to that.
Okay.
I think there's also something that maybe wasn't discussed in this process, is that the tendency of some individuals to do it on their own.
Do it on their own even when they...
I mean,
It's not good enough?
that they don't necessarily have a team, you know. And that's not always a bad thing, but it is something I think that needs to be mindful of, that there are people that are, maybe have, you know, don't have a team, or don't have those kinds of resources that others do. And just to be mindful of that.
That's right.
What part, you know, we play in that.
All right. Okay. Love to, we can talk on that, right? Unfortunately, I got to wrap this up. It was very ambitious. Okay, so I want to thank you all for participating. I'm also thankful to Dr. Marina Bluestein, who is my project chair and has guided me through this process. A few other people in my committee, Dr. Dan Hagen, who's the president of the school, and I got my career development mentor, Patrick Robinson, president of the Alumni Association. He was president of the Student Association when I started, so we both moved up together. My Tai Chi family at Normandale Community College, and last but not least, all the outpouring of support that I've gotten from my husband and my family and my friends and my colleagues. And it's been great that many of you have come tonight. So that's where we're at. If you have a survey, you fill it out, just leave it face down on your table or on the registration table. If you need a CEU certificate, Michael has those for you. Be sure to stop by there on your way out. And I really thank you all for coming. I really appreciate it. Yes. There should be one survey at least, and if you're an alumni, you should have 2 surveys. So Patrick is going to help you make sure that we have
Surveys?
surveys.
State flyers.
Oh.